Hello. Today I'll be talking about electroconvulsive therapy, or ECT for short. ECT is one of the most debated treatments in psychiatric history. We will be exploring its origins, evolutions, how it's used today, and the ongoing controversies as well as future possibilities surrounding it. Now, what is ECT? ECT is a medical treatment which uses small, controlled electrical currents to trigger a brief seizure in the brain. It sounds terrifying, and historically it was, but today it is a highly studied procedure. It is typically only used when other treatments for mental illness have failed. Now let's move on to the historical background. ECT was first introduced in 1938 by two neuropsychiatrists in Rome, Augusto Leti and Lucio Bini. Their idea was first inspired by watching pigs being shocked before slaughter to calm them. This led them to try and electrically induce seizures in patients suffering from severe mental illnesses. The first patient was someone with schizophrenia, and the results were promising. From there, ECT spread rapidly across Europe and North America. In the US, Dr. David Impastato was instrumental. He performed the first documented ECT treatment in the country in 1940 and helped refine the process for safety. Back then, there were very few psychiatric medications, so biological treatments like ECT became widely accepted despite being extremely controversial. Evolutions and changes. Now let's look at how ECT has changed over time. In the early days, patients who received ECT generally received it without anesthesia or muscle relaxants, which often caused painful injuries like fractures and made memory loss more severe. This is a big reason why ECT still carries a negative stigma today. But things are very different now. Modern ECT involves general anesthesia, muscle relaxants, and advanced equipment to precisely monitor the brain and body. This has dramatically reduced side effects and improved outcomes. Studies like the one by McCall and colleagues in 2019 show that newer dosing methods are not only safer but more effective. This has led to a resurgence in ECT, especially for people with persistent depression. Clinical application. ECT is most often used in major depressive disorder, especially in cases where symptoms include suicidal thoughts or psychosis, and other treatments haven't worked. It is also used for bipolar disorder and schizophrenia, particularly when someone experiences catatonia or severe psychotic symptoms that don't respond to medication. During the procedure, the patient is sedated, electrodes are placed on the scalp, either on both sides or just one, and a short burst of electricity induces a seizure lasting about 30 to 60 seconds. A typical course involves 6 to 12 sessions spaced over a few weeks. And while medications generally tend to take a few weeks to show results, ECT can bring rapid relief, often in just a few sessions. Relevance to psychopathology. ECT fits directly into the biomedical model used by the DSM-5-TR, which sees mental illnesses as a result of neurobiological dysfunctions. By directly influencing brain activity, ECT is thought to restore functioning areas tied to mood and behavior. This makes it especially useful in critical situations, like when someone is suicidal, where fast improvements could potentially save this person's life. Culturally, though, its use varies. In some places, ECT is seen as taboo or outdated, while in others it is very respected and even a routine intervention. Critiques and controversies. Now, why is ECT still controversial? A lot of this fear comes from its early history, when it was performed without anesthesia and sometimes even used coercively. But these practices caused trauma to the patients and even created a lasting negative image in the public's mind. Even today, critics often raise concerns about retrograde amnesia, which is memory loss for events before the treatment. Although modern ECT has reduced this risk, it still exists, and some say that the side effects tend to go underreported. Ethical concerns also come up around informed consent, especially when ECT is used in hospitals or in individuals with limited decision-making capacity. Despite all this, decades of research show that when used properly, ECT is both safe and effective, especially compared to how risky it is to leave a patient untreated. Future directions. Looking forward, ECT continues to grow even to this day. Researchers are working on neuroimaging and biomarkers to better predict who would benefit from the treatment. This would lead to more individualized care and fewer unnecessary side effects. There are also some new techniques being developed, like magnetic seizure therapy and focal electrically administered seizure therapy. These aim to maintain the benefits of ECT while also reducing its risks. Public education should be another big focus. Reducing stigma would help patients make informed choices about their care. Personally, I used to think about ECT negatively due to the way it's portrayed in media, but after all this researching, I think it's a great last effort due to both its efficacy and safety. And here's my references page. Thank you, and I hope you have a lovely day.